Hello, Dr. Sanjay. I'm hearing some great things about an idea that you have, the Wound Care Legends of India. What is this project all about?
Share with you the concept that I have been having. You and I have seen wounds from our childhood. It could be a small laceration when we have fallen on the ground, or a big cut in the eyebrow and things like that. And these are small wounds which heal faster. And you at Urgo Medical have been looking at wound care as an industry and seeing a lot of chronic wounds. And that's why your dressings have been used in various chronic wounds. It could be venous ulcers, it could be diabetic foot ulcers, tropical ulcers, pressure ulcers, and the list goes on. These wounds take a very long time to heal, at least about 12 to 52 weeks, so as to say, from an Indian context. And especially in diabetic foot ulcers, and every 20 seconds a limb is lost due to an ulcer or due to a wound that we say. So, and to treat these wounds, there are very few clinicians who are doing it, and these clinicians are doing it passionately. And this passion is something that we need to look at, because we are not trained in a wound care specialty during our MBBS courses or MS courses. We are trained in probably liver transplant surgery, or a kidney transplant surgery, or a general surgery like an hernia or appendix. Or if you look at the orthopedics perspective, we are trained in knee replacements and hip replacements. But wound care is looked at as a very small thing when we are getting trained, but when we actually start practicing, we see a lot of patients with these chronic wounds which can lead to amputations. And to treat these wounds, the clinicians are passionate, they are resilient, they work with patients. So as to say, I would always say the clinicians have to have a lot of patience to treat the wounds, and the patients have to have a lot of patience to undergo the treatment for such a long time. This passion is something that we need to bring out. Why did these clinicians choose wound care as their specialty? Why did these clinicians have been so passionate about wound care? Why are these clinicians so passionate about preventing amputations? This is something that we need to bring forth to the other clinicians around and share the knowledge of how they are doing it, why they are doing it, and what they are doing, and also to the general public, so as to say, and what really involves in wound care.
That's great. I think it's a brilliant initiative. And at Urgo Medical, we are very passionate about bringing the stories that we will learn from these legends will inspire a lot of other clinicians, industry personnel, and members of the public to do more about people suffering from the burden of wounds. And thus, I'm really excited today to launch together with you
Wound Care Legends of India.